Jo, thank you for joining us and welcome to your new role as CEO of the College of Sexual and Reproductive Healthcare. So firstly, what drew you to CoSRH and to the field of sexual and reproductive health more broadly?
This is a really, really interesting time for the college. Obviously, it is a college now, not a faculty, so that opens up so much more in terms of opportunity, in terms of outreach and engagement, and really broadening what we do and the impact that we can have. So that was something that was really exciting to me when I saw the job come up. In terms of sexual and reproductive healthcare, obviously women's health is extremely important, and it's personally very important to me. You'll notice that I am quite different to Gary in a lot of ways, and so I do have a little bit of a vested interest in women's health.
CoSRH is a young college with a fast-growing profile. How do you intend to build on this momentum?
So again, it's such an exciting time for the college. We've got really strong brand, we've got a really strong presence that is growing, and there are so many opportunities at the moment, politically and socially as well, in terms of really exerting our influence, really inserting ourselves into the conversation and the public and political discourse. We've got workforce planning happening in England, excuse me. We've got the NHS 10-year plan. All of these things, plus everything that's going on in the devolved nations, means that we have a fantastic opportunity, not just to raise the profile of sexual and reproductive healthcare, but also have a huge impact on our members, on people who may wish to be our members, who may wish to work in sexual and reproductive healthcare, but also for all of those members of the public and patients who we serve.
SRH as a whole faces well-documented challenges, not only workforce pressures and fragmented commissioning, but the rise of misinformation online. What do you see as the biggest challenges CoSRH needs to help solve, and how?
Misinformation online is something that I think we all recognise as a huge issue in healthcare generally. But I think there's a real opportunity here for the college to raise its profile, be a trusted voice, and be seen and heard more broadly. So there are actually opportunities in those risks. We must make sure that we're speaking up for our members, those folk who are working in sexual and reproductive healthcare, whatever their role, and make sure that we are taking those voices into discussions with policymakers, with those people who can make the decisions that make a difference to them and inevitably make a difference to patients. So I think there are real opportunities here to really emphasise the work and the importance of the work that the sexual and reproductive healthcare workforce does.
The Hatfield vision remains central to the college's advocacy work. After attending your first task force meeting last month, how do you hope to drive this forward?
The Hatfield vision is obviously a huge part of the college, and it's driven so much excellent work. I think making sure that work is embedded in the work of the college more broadly, making sure that we take the credit for what we've done and what we continue to do, I think that's going to be really important in terms of, again, raising the profile of what we do and really impressing upon folk the importance of that work as well.
Education and training are core to our mission. Are there areas where you're keen to see development or innovation?
I think we need to make sure that we are representing the whole of the sexual and reproductive healthcare workforce. I think there are real opportunities there to make sure that we are really demonstrating that this is a multidisciplinary college. We are unique in that we're the only one in the UK that is multidisciplinary, truly multidisciplinary. So I think we need to embrace that. I think we can go further with that, and I think we need to demonstrate to not just the workforce but also to patients how integrated that workforce is.
Members are at the heart of everything we do. How would you like to see them engaging with the college and even with you in the months ahead?
Members are the absolute lifeblood of any college, including ours, and it's really important that we hear from them, that we are shaped by them, that they influence what we do and what we say. What they are experiencing in the workplace, that is what we should be talking about. We need to know, we need to understand exactly how things are feeling out there, how things are working, what things aren't working, what we need to see more of, what we need to see less of. And so I think it's really important to keep those lines of communication open, including directly to me. So I'm not that difficult to track down, so please do get in touch.
And finally, a more light-hearted question. Outside of work, how do you like to recharge? Any hobbies, passions or routines that keep you grounded?
So I love theatre. I've become a little bit obsessive of going to Stratford to watch Shakespeare plays, which sounds really highbrow. And I'm going to take that. However, my secret pleasure is that I watch Home and Away every day, and yes, it is still on. So I'm a little bit, highbrow and very lowbrow as well. I love watching a bit of trash TV with my cat, who's called Dr. Abigail Bartlett. And if you know the West Wing, you'll know who that is. Usually curled up on my lap or shouting at me for dreamings. I am a cat slave. So that's what I do. I do punish myself at the gym as well, but then I ruin it all by eating cake afterwards.
Perfect. Thank you, Jo, and good luck for your time ahead with us.
Thank you.